Thousands of folks in the valley eagerly waiting to get the COVID vaccine, and as we've reported, health workers are first in line. But some doctors are locally already starting to vaccinate the general public. Channel 5's John Paul Barajas explains how that's even possible. That story all new tonight.
We've gotten numerous calls from concerned viewers about a doctor's office here in the valley that may have been jumping the line when it came to administering the COVID-19 vaccine. We gave the offices of Iglesias and Associates a call. Here's what we found out. This is what both of their offices looked like Saturday morning. The one in San Juan telling us they ran out of the Moderna vaccine by around 10 a.m. when we called, but the one in Pharr still had a decent crowd around 1 this afternoon. The reason why? They were told vaccinations at these locations were open to everyone.
All I know is somebody told me that this was going on, and like I told you, if I have an opportunity, I'm going to take it.
We spoke to a woman waiting in line. She falls into the category of the general public. She's 63, 2 years shy of the age considered to be elderly, and she's not a frontline or essential employee. Yet, Moderna's vaccine was available to her at the Iglesias and Associates clinics.
There's some guilt involved in that there might be first responders that still have not received their immunizations. Again, like I said, I didn't actively go out and look, but once I was told that this was available, I'm going to see if I can take advantage of it.
We called the clinics ourselves. Dr. Norma Iglesias was not able to speak because she wasn't at the office, and for privacy reasons, they couldn't pass along her number. So we left ours and are waiting to hear back. An employee did confirm they were instructed by Dr. Iglesias to pivot and offer the vaccines they currently have to everyone. According to the Department of State and Health Services, the two clinics did just receive 1,000 doses of Moderna's vaccine.
Do you believe we've made it to that point where we get to general public and have moved on past the elderly and severely ill?
Absolutely not. I think there's still a lot of people that are elderly, have comorbidities, and at risk, and there's still a lot of healthcare workers that have not been vaccinated.
Hidalgo County Health Authority Dr. Ivana Melendez went on to say Dr. Iglesias' decision isn't necessarily wrong considering the vaccine's shelf life is so short. You have to act fast or risk wasting the vials.
But I think this particular practice did the exact same thing that our state health department has recommended and that the hospitals are doing, is that she was able to pivot.
On Wednesday, DSHS Commissioner John Hellerstedt sent out a letter about vaccination administration that reads in part, there is no need to ensure all of your 1A group has been vaccinated before starting 1B vaccinations. If in a given situation all readily available and willing 1A and 1B persons have been served, we urge you to pivot again and provide vaccines to any additional available and willing persons, regardless of their priority designation. The letter then saying, every shot administered matters. Melendez says come February or March, the vaccine should be available to the entire general public, and that he hopes by the summer, everyone who wants the vaccine will have already gotten one. John Paul Barajas, Channel 5 News, this weekend.